Hello, and welcome to the New Rules of Sex Summit, your sexual re-education. My name is Dr. Lauren Brem, and I am here today with Dr. Jennifer Lang, OBGYN, gynecologic oncologist, author of The Whole 9 Months, health and wellness consultant at The Honest Company, and co-founder of a new tech startup to address sexual assault prevention. So welcome, Dr. Lang.
Hi, Lauren. Thanks so much for having me. It's so great to be here.
Yeah, so we did another summit talk with an OBGYN talking about STIs and libido and sexuality. And you have this really fascinating side, the sexual assault side. You have this background in curing cervical cancer. You have, you know so much about human rights and reproductive rights. So I really want to spend our interview touching on that. And I'd love to start with, when women go into the doctor's office to meet with an OBGYN or any healthcare practitioner, they often sort of hand over their rights, talk about consent. I mean, there's really often really poor consent that even goes on in those settings. So, what do women and men or anyone listening need to know are their rights in those settings with a healthcare provider?
I love that question because it's really getting to the heart of what I'm trying to address with my work right now around issues of consent and body autonomy. And also as a mother, I've got 3 young kids. I really believe that we need to be teaching these principles like we teach the alphabet, just from the earliest ages and even, pre-literate, just being aware of, our body space. If somebody wants to come into it, touch our body, they need to ask, they need to make sure that it's okay with us. And we need to really check in with ourselves. Do we want to be touched right now? And so I feel like if we could raise a generation that has a little bit more just awareness over honoring their own desires about, touch to begin with, we would end up with women walking into a doctor's office with a whole different perspective. It is not open the door, take off the clothes, and I cede all of my rights. It's quite the opposite. I maintain my rights with me at all times as I move through my entire life. And that doesn't change when I'm at the doctor's. It doesn't change when I'm at the dentist. It doesn't change when I'm in the club on the dance floor. It's all the same,
Yeah. And, as a sexual coach for women, I hear a lot of stories where, they walk into an office and yes, their unnecessary exams are taking place or, certain things are said. So what are some kind of practical things that women can do or I always, when I was a birth doula and an advocate for women, I would always have them say, okay, is that really necessary? What are we going to accomplish with that information? Asking more questions, saying, well, stop, get more information before you just proceed. I mean, what are some suggestions or what do you think?
Yeah, I think that communication, like in all things, is really important with a healthcare provider, whether it's a doctor, a nurse practitioner, a midwife, whoever it is that we're coming in contact with. We need to make sure that there's a level of comfort, and a basic level of trust. And I think that some women have no issues just taking off the clothes, anybody touch that, and they're just comfortable that way. Yeah. That's totally fine. If that's not you, would encourage women to find their voice, to say, what they're comfortable with. And if they have a concern that they're being asked to disrobe inappropriately, like I've got a spot on my arm, why do you need to do a pelvic exam? That kind of stuff, to speak up and to ask questions. And, physicians in particular can be a little brusque sometimes, a little short for time, make women feel like, every question is just taking up more of my precious time. That's not a great relationship to be in as a patient doctor. That might be an indicator to find a different provider. If
Yeah.
you
Yeah,
should
that's what I was thinking.
always
You
feel
need to be able to
comfortable.
walk out, right? Like
Yeah.
sometimes you need to say this isn't the right practitioner for me, or no, I'm not, I'm going to find someone else, or I'm going to find someone who's, more sex positive or LGBT
Yeah.
friendly. And you can interview your healthcare provider to
Uh-huh.
get more information.
Yeah. And I'll even say, just like sex and sexual consent, you can be in the act and still say no. You can
Absolutely.
be
Mhm.
on the table and
Mhm.
somebody can make a comment that is really disturbing to you or
Mhm.
touch you in a way that is really uncomfortable, and
Mhm.
you can draw a boundary there, you know?
Mhm.
So women just need to feel comfortable and confident that they can trust their intuition, they can trust their sense of how this interaction is going. They
Mhm.
can draw boundaries verbally with their body language and make it clear to a healthcare provider what's okay, what's not okay,
Right.
like every other aspect of their life.
Good point. Yeah, some of the images I have are seeing that there are tons of interns or medical students observing an examination. Like you have a right to say, I don't want those people in the room, or I'd like a different doctor or a female doctor, or when you're in labor, I don't want vaginal exams from every different nurse who's like rotating and walking in the room. You have a right if the doctor does say something, well, I've heard some very shaming comments that, women have, oh, well, if you weren't, having sex with so many partners or whatever said to them while they're getting checked, you can stop it in the moment. You can immediately go tell someone about it. When these things stay silent and we go, then they just that shame just, it hurts us and wounds us.
I'm very sorry to hear that. I really wish that there was more of an emphasis in medical school and training on basic uh, communication habits and being ultra conscious and aware of that judgment and shaming that people can do that can be so wounding, and particularly when it comes to issues like childbirth, or where it's already such a loaded, it can be sometimes stressful situation, to have a judgmental, comment dropped in at that moment can be really devastating.
Yeah, absolutely. So, well, we're mentioning childbirth, but I also wanted to talk with you today about abortion and the right to abortion, because we haven't brought it up in this summit yet. And if you're having sex, there's always that possibility of pregnancy and an unwanted pregnancy. And, we're seeing a lot of changes in the United States right now with our rights to healthcare. What do you feel as an OBGYN is really crucial as a part of women's reproductive rights?
I think that honoring the unique relationship between a woman and her provider is really crucial. I think that women, my personal belief is that women should be allowed to make decisions in partnership with their healthcare provider, independent of any regulating, agency or body of, lawmakers. That kind of regulation should not be inside of a doctor's clinic, or affect a woman's body autonomy. Again, this goes back to consent. Women as owners of their body that can become pregnant need to be given complete information and be allowed to make informed choices and decisions about their own bodies. And I think that is the essence of what pro-choice means. That it's our body. We should be able to choose if we want to use birth control, what kind of birth control feels right for us, if we are ready to procreate and carry a pregnancy, if we're not ready, and what those options might involve.
Well, and when we look at women's health, when women don't have access to abortion because they are going to seek it out, whether you agree with it or not, and if they don't have access to it, they will find a way, and it's often can be a more dangerous way. Or what's the science? What does science show us happens when women don't have access to abortion or even just regular reproductive health care? I mean, you've seen this with your company that you co-founded, Cure Cervical Cancer. We need access to reproductive health care and birth control and all of that. So what happens to women when they don't have that?
Well, entire communities suffer. We know that, for instance, the more years of education a woman is able to attain, the more likely she is to choose family planning methods that, and have fewer children. And that means that each one of the children that she does choose to have in a planned way has a greater likelihood of surviving, number one, past infancy, getting medical care, going to school. When a woman is in control of her reproductive lifespan, families and communities do better. When she has access to basic things like prenatal care, it's more likely that she'll have a positive birth outcome and less likely that she'll die in labor or the baby will die in labor. When she has access to cancer screening, it's much more likely that, precancerous lesions can be caught early and, an entire family doesn't lose their mother to an entirely preventable disease like cervical cancer, which is 100% due to lack of access to healthcare. So I get personally very concerned when I see issues of access in this country getting reduced at any level. Planned Parenthood is a wonderful example because, for all of the hype and the propaganda, you would think that all Planned Parenthood did was provide abortions, and that could not be further from the truth. They're doing basic, everyday, preventative women's health care. They're preventing breast cancer, cervical cancer. They're providing access to contraception, which reduces the number of abortions. The less access to birth control women have, the more likely they will be to have multiple abortions in their lifetime, which is far from optimal. No woman wants to have an abortion.
Or use that as a birth control method.
Right. Absolutely not. Absolutely not.
And with the education piece, we need that in school so that women understand how babies are made and how to family plan and all of that. But we provide no education, and then they take away the abortion, and then women, are not prepared to bring children into the world. And adoption is not this easy route. Oh, just give it up for adoption. I mean, all of these things are, when I work and coach women, abortions and adoption and, pregnancy fears, all of this. I mean, it's not fun to go through, and it can leave a real emotional scar on your sexuality. And, so it's in a sexuality summit, it's important to talk about all of these things because they do impact us. If we want to feel really free in our sexuality, we need to know how to prevent a baby, that we're taking care of our bodies. I talked to a friend the other day who hasn't been to see a gynecologist in years for her regular PAP or anything like that. I mean, it's been like 11 years. And I'm like, and it's because she's had bad experiences with doctors and there's fear. And so she's just like, I'm just going to avoid it. And yet we know, I mean, I loved that when I was training to be a midwife, because you realize like, okay, I want live women and live babies. And how do I use the science to get there? And it's like women just having regular access to healthcare, someone taking your blood pressure and monitoring for, any signs that something's going wrong is like, and just witnessing you is so powerful in just supporting your health. And then you can enjoy sex more because you're not, not taking care of yourself. And
absolutely. You had also mentioned what happens when women don't have access to abortion. And, this, unfortunately, I feel like this generation of doctors that I'm a part of, we're going to start seeing what our previous generation that trained us grew up with, which was entire hospital wards dedicated to women who have undergone what's called septic abortions, have pelvic inflammatory disease, are dying of sepsis, and these are the results of, lack of access that is high quality, that is clean, that is legal, that is affordable.
Yeah.
And so as you see states limiting access, which we see right now, women having to drive, days to other states sometimes even to get access, all of those things are limiting a woman's ability to, if she wants to get an abortion, to get it earlier in the pregnancy. And the further along in pregnancy you go, unfortunately, the higher the risks. So, I really hope that it's not, we're already seeing an increase in maternal mortality, things like this, as women's options, reproductive options are decreased. And sadly, the United States has actually the highest maternal mortality in the developed world. And, the further we go down the road of limiting women's access to the full range of healthcare options, the more that number is just going to increase. So I think it is absolutely essential that we, vote in a way where laws maintain the basic human rights of women, which are to access a full range of health options just like men. We have to have uteruses, so they're somewhat different.
I'm remembering meeting a woman and a woman that trained under her that were, during the time before Roe versus Wade, were performing at-home abortions, and and I think one of them was a nurse or something, but they were at risk of going to jail and all of that, and they were very busy helping women and doing this in their homes and through this vacuum extraction method or something like that. I can't remember the details, but it does seem like, oh, that was so long ago that women were trying to end pregnancies with stories of wire hangers and things like that. But you're right, if we take that access away, we're gonna see a rise in that again, women trying to. And I think it's interesting what you said, it tying into consent and, having sovereignty over our own bodies and the right to say what you want and what you don't want. And, in many cases, we can find ourselves either with an unwanted pregnancy or an STI or just a bad experience that causes us to shut down sexually because we don't have those tools to navigate consent and say what we want and what we don't want. And we kind of, you'll still hear women say things like, oh, well, I started it and then I felt like I had to finish it or go through with it because he was turned on or he had an erection or, something like that. So maybe you could speak now to preventing sexual assault and, what that looks like so that women are having more positive sexual experiences and empowered sexual experiences that lead to better outcomes.
Sure. Well, obviously it's an issue that I care passionately about, and I'm devoting this next chapter of my professional career entirely to helping reduce rates of sexual assault, which are epidemic in our population. The Me Too movement has absolutely shown that basically every woman has had some kind of experience of unwanted sexual touch, maybe not penetration, but sexual assault doesn't need to include penetration to be just as traumatic.
Right. You could be sent a sex video. Someone sent me a picture of a penis the other day. I was like, I didn't consent to that. I didn't want to see that.
That's right.
Yeah.
Unsolicited. Yes. Unwanted. That's right. Visual assault. I agree.
Yeah. Or masturbating in front of someone or even
right.
Talking to someone in a sexual way or talking to them about sex is like forcing sex on you. We have such a penis and vagina sex model, but sex is much larger than that.
Right. That's right. So if we can, again, bring it back to my kids, if we could just talk to kids about building empathy with each other so that they are learning to read, not only the visual cues, but the verbal ones, the body language about, is somebody open and accepting and welcoming enthusiastically, or are they kind of going into a freeze or a shutdown or a turning away or a pushing away? If you're asking, is this something that you want to do? Is it like a yes, or is it a yes?
Yes, please.
Hell yes, please, yeah. And really keying into that and learning and practicing this reading of situations from a young age. So, when we talk about healthy sexuality, unfortunately, many adult women have experienced sexual trauma. So, the highest age risk group for sexual assault is ages 16 to 19 in women. These are very young women. And sometimes these are some of their very first sexual experiences, can be traumatic. And this poses an enormous challenge to women then kind of proceeding on in life with a healthy, full, expression of their sexuality. It can be layered with so much of the remnants of the trauma.
I didn't realize that age 16 to 19 was the largest group. Is that, what are some of the factors influencing that? I imagine alcohol use is a part of that, but what else is going on there?
So I think alcohol is a giant factor here. And in fact, for instance, if we look at campus sexual assault, 70% of all reported assaults involve alcohol.
So 70% involve alcohol of campus reported sexual assaults.
Yes. And I think what's happening in that 16 to 19 age group, which, of course, in most states is underage for alcohol, but, teens and young adults are exploring alcohol for the first time. They're not really sure the effects of what that's going to have on their body, and they're exposed to situations which can become sexual at a point where they essentially lack the capacity to give consent. So in order to consent to a sexual act, you have to have what we call the cognitive capacity. And alcohol is a neuroinhibitory drug. It basically dulls our brain cells and inhibits our ability to think, to, our level of consciousness, and also our ability to form new memories. So, people kind of joke about, I don't remember what I did last night. Well, that's a blackout. And that means that they had a level of blood alcohol content that was essentially beyond the point where they could have consented to sex. So if you're having sex in a blackout, that is really by definition non-consensual sex. Unfortunately, right now, we really don't have many tools to determine how intoxicated somebody is. And so we just have to do the best job with the tools that we have. My company that I'm working on right now is hoping to give additional tools to aid in that conversation. So it's really exciting. And I think that we could be having a conversation within the year where we're looking at having a lot more information when two people are encountering each other and making a decision whether they want to interact sexually or not.
I flash back to the first time that I had sex, and it was in a blackout, and I didn't know that penetrative sex had happened. I just woke up and no longer had pants on, but it was when I saw a gynecologist that said, you have abnormal cells on your cervix, and you clearly have had sex. That but I know for me, I knew what the alcohol was doing, but there was so much shame and fear and everything about sex that I needed to numb to even have an experience.
Right.
That the culture was not was not supporting that. There was not a safe place to explore that desire. And then, yeah, on top of that, sometimes you don't know how quickly you are becoming intoxicated because you haven't eaten or you're a smaller body. So I think it's great that technology is starting to help us in so many ways, understand our bodies better, know how intoxicated you are, helping us understand our cycles. And, we live in such an amazing time.
That's right. So there's a learning curve that's happening in that age group, not only about alcohol and other substances, cannabinoids.
Mm-hmm.
Now people are taking benzos like Xanax, Valium, adding that to the mix.
Okay.
It feels like there's a new, popular drug every 6 months. So, you're on that learning curve, and then you're also on the sexuality learning curve, learning what feels good to you, what you want, what doesn't feel good. Maybe you've seen something, you've been exposed to pornography, you've seen something in a film, and you think, oh, I'm supposed to do it that way, and you do, and that's not something you want. So you have to, it takes a certain amount of self-confidence to actually declare what you want and what you don't want.
Yeah.
And I think a lot of young people in that learning curve, they haven't developed that self-confidence yet.
Well, I like what you said about what you see with your kids and how you want to raise them and developing empathy. And one of my mom friends I've just watched her do this with her kids. And I went, oh my gosh, that's so cool. When another kid is hurt, she tells her kid, like, do you want to check in with them and see how they're doing? And like that whole check-in thing. And I'm like, that is what we need to be doing with each other all the time. Like your face just changed, your body contracted. You can check in, like, what's going on right now? And it doesn't mean that the sex stops and never comes back, but you're just stopping and checking in and like getting more information. And I also love this idea with consent too, that it's not so black or white, that it can be, I don't want that now, but check in with me in 10 or 20 minutes, or I don't want that, but I would like this experience. And there's just so much nuance and things that we can learn to do with communication and consent to get our needs met. And I think now we just try to do this whole mind reading thing and not say anything and just push for more until the other person says no. And it's a really poor model.
Very poor model. And, our complete lack of adequate sex education in this country doesn't help. It's a minority of states that require any sex ed at all in the classroom. And of those states that do, most are abstinence-only programs or abstinence-focused programs, pardon me. So it's really not addressing the full scope and reality of people's behaviors. So what you have is people out in the world just figuring it out as they go. And unfortunately, a lot of pain and suffering along the way that needn't be there. But you're absolutely right about the fluid nature of consent. I really emphasize that, and that this is not only a guy that needs to ask for consent, a girl that needs to give consent. This is
all those little genders along the way.
Absolutely. And the assumption that men will always want to proceed is a false assumption. And so it should be a mutual checking in along the way. And that's no matter what kind of sex, between what kind of gender you want to imagine.
Yeah, I like that checking in and developing empathy. It's like developing awareness of how other people are responding to your actions and being open to hearing that information too.
And the sex will be way better.
So much better. Yeah, I always tell people that some of the best sex has come after just those check-ins. And maybe, you stop having sex for 5-10 minutes and you're talking, and it's some seemingly unrelated thing sometimes, often has nothing to do with the partner, sometimes it does, and then all of a sudden, like, the erection reappears, or the woman suddenly is like, I want to have sex with you now, and it's like, it's just amazing when we create that space to talk about that, what opens up. sexually.
That's right.
Yeah.
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 It's a mindfulness thing. It's a being present. And it absolutely amplifies the enjoyment and the pleasure.
Yeah. So I wasn't planning to go this direction with your interview, but I'm just thinking, you wrote the book, The Whole 9 Months.
Yeah.
I happen to know about your personal experience of pregnancy and giving birth, and I know that you're a very sex positive gynecologist. So I wonder if you could just share a little bit about, what you would like women to know about their sexual potential in pregnancy and, as a mother and all of that, just to really share a message with those women that, often women shut down their sexuality in pregnancy and in birth and postpartum. So what would you say to them?
That it's all fluid and it's highly individual, and we shouldn't make any assumptions, and likely everything will change. So, or nothing will change. So a woman might find that she actually becomes more sexual in pregnancy. That's absolutely the experience of many women. They have different hormonal levels flowing through their bloodstream. They have sexy dreams. I've certainly talked to women that have experienced orgasm in their sleep for the first time during pregnancy. So, bodies can change, breasts can swell, a partner can be like really turned on by the new curves that are, appearing in a woman's body. So, my advice is to, again, just be mindful, present, have compassion for yourself. You might want more sex, you might want less sex. Both are fine, and, a lot changes in pregnancy and also after delivery. Sleep patterns change. It can be, the postpartum period can be a time of sleep deprivation. Some women might find that when they're exhausted and breastfeeding every, 2.5 to 3.5 hours, they're just not in the mood for sexual touch. And that is fine. And it's really about being, if you're a partner to a woman, being empathetic to that experience and offering the support where needed, and because sexual arousal is, a function of the parasympathetic nervous system, the more stress a woman is under, the less likely she's going to experience desire and arousal. So things as simple as, making sure that the dishes are done, can relieve her level of stress, and increase the chance that she'll want to be sexy. So, all of those things.
There's so much negotiation that can happen in it, and it could be that the male partner or the female partner is freaked out by having sex with the woman because they're like, oh, there's a baby, and they might feel it or see it. It might be that the woman has some concerns because she has had a doctor say, now, like, don't, no reason to do that, or it's not, there's a TED Talk about this, women being told, well, it's best to just avoid sex during pregnancy just in case, even though there's no dangers of sex during pregnancy, but, just finding out like where the other person's coming from. And, and if you're wanting to have sex with a partner who is exhausted, yes, it could be saying, what can I do to support you so you can have more self-care time so that you're able to show up? Or maybe it's negotiating, I can't do penetrative sex right now, but I'll lie with you while you masturbate, and, we can kiss some, or you can give me a massage if you want to touch my body. And, we can just talk and negotiate things. It's not so like black or white, sex or no sex.
Yes, that's right. And again, there are so many ways of having sex that, even if, a woman is not wanting vaginal penetrative sex, maybe oral sex would feel good. Maybe, just erotic touch would feel good. So
Yeah.
Yeah. Again, there's
Kissing,
no rules.
vaginal touch. Yeah. There's so many ways to connect, and even just being naked skin to skin without the pressure of sex will sometimes make a woman then change her mind and say, oh, actually I do want sex, but just the pressure of it was turned her off. Or
Right. Right.
Yeah.
But I'm glad you brought up that absolute myth, which has been, perpetuated, that it's, sex in pregnancy is risky or dangerous. There are very, very few cases where, sex would not be recommended in pregnancy. Mostly related to like severe prematurity, ruptured membranes well in advance of a full-term baby, those kinds of things where we would say, yeah, maybe not. But that is so rare and so uncommon. A lot of those myths just need to disappear.
Yeah.
And in fact, the benefits of sex in pregnancy are well documented and numerous, from reduced back pain and discomfort to better sleep, to reduce stress, all of this, improved intimacy in the partnership, which absolutely benefits the baby if there's a partner at home. So many reasons to have sex, and few reasons to avoid it, medical reasons, I'm saying.
Yeah. What would you say to the LGBT population seeking healthcare in a world where, physicians are not very educated? There was a study out this last year saying that, many of them don't even know they're working with an LGBT patient. So what do you think, how do you think healthcare needs to advance, or sexual reproductive healthcare, to meet the needs of an LGBT population? Like, for example, with bisexual women, we know that there's a higher rates of certain things, and with lesbian women, so that it's important to have this information. How do we create an environment where it's safe to have those conversations in healthcare?
Again, I believe that if there was better quality sex education in our general education system, you wouldn't have people ending up in medical school who haven't been exposed to this basic information. Right. But assuming that doesn't change, we should at least do a better job in medical schools and in residencies in assisting providers in becoming more fluent about the full range of human sexuality, and destigmatizing some of these topics. But essentially, if you can tell if a provider is very uncomfortable discussing something, and that just might not be the provider for you. So I don't currently have a clinical practice. When I did, I used to wear a little pin, which was the symbol for the medicine with the staff and the serpents. That was a rainbow pin. And I would always wear that so that any patient who came into my clinic would know that I felt comfortable talking about human sexuality, LGBTQ issues, that I was not going to make any assumptions about their orientation or their preferences without asking.
That's really cool. I mean, I think so many people just they find the doctor or dentist or provider or whatever and then they just stay with that, even if it's not a good experience. But you remind me that we really can seek out, in the same way we seek out the best school for our kids or the best food for our bodies. Like, you can really encourage people, like, find someone who's sex positive or who talks with you more, or there are naturopathic gynecologists. There are you can just keep looking until you find something that's a great fit, so you're not afraid to go to the doctor's office, so that you're not afraid to take care of your body, your family planning, the microbiome of your genitals, all of these things. It's important we take care of our bodies if we want to enjoy them with our sexual partners.
Absolutely. And feeling comfortable is, I would say, the single most important thing at the root, at the beginning of all healthcare interactions, because if you're not comfortable, you're not going to give the full story. The provider is not going to be able to make a holistic diagnosis and give you the appropriate recommendations.
Yeah.
So,
Oh yeah. I've lied to healthcare practitioners over the years. You can feel like the judgment, or you can feel it's not safe. And, they say, how many sexual partners have you had or whatever? And you're like, 2, just like, so yeah. How do we create a space where we can really, and you can feel whether or not it's a safe environment. And I love discovering the LGBT health center here in Los Angeles. And, you go there and you're just like, oh, if it's such a comfortable, non-judgmental environment. And I know, so many people don't have access to that, much less basic reproductive health. Now we've got abortion access that's limited, and it's just, there's a lot that needs to change in this country as we prioritize women and sexuality and education. And, now this conversation about consent, that is so, so important. I mean, this has been on hold for way too long, and women have experienced, and men, so many assault experiences because they just didn't have the capacity to communicate and navigate consent.
I've been really encouraged over the past year with the number of women having the courage to share their stories, and how that is helping so much for other women to know, they're not alone. It wasn't their fault. It was, for it to be this pervasive in our society, you can't blame yourself anymore, because because I wouldn't blame you, I wouldn't blame her, I wouldn't, sorry for this stuff.
Very popular lady.
Apparently.
Off the hook. Yeah. Yes, so, it's been fantastic. Well, thank you so much for this conversation today on consent and healthcare and all of these more cerebral issues that are so important as a foundation for our sexuality, the healthcare and the consent and all of that. Where can people follow your work or hear about new books, or what you're up to?
Well, I've got the Amazon author page, which has updates, and I have a new book that should be out in November that's on the issue of sexual consent. So look for that.
Yeah.
And my tech company, there should be some really exciting announcements in the next month or so. So,
well, hopefully when this video goes live, that will be live, and we can share the name of it and put a little link so that people can learn about it and have that as another tool of empowerment in those sexual conversations and navigating who you want to have sex with and when and what you want those experiences to look like. And it's a great conversation to be having. So thank you for your time today.
Thank you for holding a summit like this. It's so important.
Oh, well, thank you. And thank you everyone for joining us, and we will see you at the next interview. Bye-bye.